There's also a new treatment for COVID-19 that is showing some major promise for those that are hospitalized with the virus. And one of those that has put this study together is Dr. Ernst von Schwarz. He's joining us this morning, as he has been during this entire pandemic. Dr. von Schwarz, these findings are very promising, especially for critically ill patients, correct?
That's right, Joe. Good morning. So we did a pilot phase study, small study, but the first which was randomized, placebo-controlled, to test a single stem cell derived biomolecule injection, which is not officially FDA approved. That is why it's tested in clinical trials, versus placebo in critically ill patients with COVID-19 in intensive care units. So one single injection intravenously resulted in a significant reduction of mortality, basically. Again, small study, 13 patients per group, placebo versus verum. And those ones who received stem cells, in that group, only 1 out of 13 patients died, whereas in the placebo group, 7 out of 13, so almost 50% basically died. So that's a significant improvement, probably caused by what we call anti-inflammatory effects of the stem cells, which have some protective effects for the lung tissue.
There's no actual treatment, or at least one go-to treatment for COVID right now. Is this something that possibly could be what we use, medical professionals use in the future?
Well, I think it's way too early to say because, again, that was a pilot phase small study only. We don't have any directed treatment. We only have supportive treatments. As you know, we use steroids. We use drugs like remdesivir, for example. Now we heard from Merck the development of molnupiravir, which is an antiviral drug, which is under review with the FDA right now. But the only data we have, of course, are from the manufacturer, from Merck. We don't have any published data yet, but it's very promising. There's more to come. There's 2 other drugs in development from Pfizer and Roche in clinical trials as we speak.
When it comes to this stem cell study, this small group that you have, what does it actually do to help the patient that has COVID? What's happening inside the body?
Well, COVID is a systemic disease. So basically, it does not only affect the lung, but the entire organ, including the blood vessels. It's a chronic inflammatory, it's an acute inflammatory disease. So, and the stem cells, which in my opinion is the future of medicine anyhow for many, many other conditions, even though nothing has been proven with regard to cure of any diseases so far, but there's anti-inflammatory effects of stem cells. There's what we call angiogenetic effects, meaning the buildup of new blood vessels is promoted, and with us, the oxygenation and perfusion of critically injured organs is improved. And there's some what we call regenerative effects, meaning rebuilding of dead and damaged materials, possibly induced by stem cells.
Dr. Ernst von Schwarz, it's a fascinating study, and you're part of it, and we thank you for joining us and explaining a little bit more this morning here on Fox 11.
Thank you so much, Joe.